guys, welcome back again to my YouTube channel. My name is Ria. If you're seeing my face for the very first time, hello, you're welcome. And if you're a returning subscriber, what's up G, how are you guys doing? So in today's video, I'm going to be giving you the interview questions for the role of a healthcare assistant. Okay, I put out a video talking about how you can land a role as a healthcare assistant. If you haven't seen that video, I'll link it somewhere up now. Okay, please do see it. And then in the comment section, I said to let me know if you actually want the questions, and someone actually said she wanted the questions. Here I am giving you the interview questions that I was asked. So I actually did go to a number of healthcare assistant interviews, so I think about 4 or 5. So this particular video is a combination of all of the questions that I was asked. I have about 36 questions here written down. So if this is the kind of video that you're interested in, please do keep on watching. Question is a very popular one. If a client falls or a resident falls, what will you do? Normal instinct as a human being is to say, oh, I will ask them, are they fine, and then I'll pick them up from the floor. Please don't say that in an interview. You are not, as a healthcare assistant, allowed to pick anybody off from the floor if they have fallen. Okay, the first thing that you're going to do if you're in a nursing home setting is to ring the bell. There are always bells in the rooms, on the corridor, in the diner, in the toilet. There are bells everywhere. So ring the alarm and the nurse or somebody will run down and help you. The nurse or the physiotherapist is the only one allowed to give the go-ahead to raise the resident up from the floor. It is not your responsibility to do that, so please don't go saying I'll get them up from the floor. You're not going to get anybody up from the floor. Okay, just ring for help and help will come and help you. Okay, thank you. So as a carer, the health status of a client is actually private. So in situations where, like, let's say you're in a nursing home setting, okay, and you have other residents as well, and maybe they saw an ambulance or like people come take another resident that is their friend out of the nursing home to the hospital, okay, and they're asking you, oh, where is this person, or where is Mary, what's wrong with Mary, I saw the ambulance take her out, is she fine? What do you do? It's not your business to tell someone else another person's problem. Even in normal life situations, you don't go around telling other people's problems to other people. I don't think it's necessary. Okay, so just assure the particular person asking that, oh, this person is fine, she'll be back. Don't give any confidential information. Don't give too much information. If not, you just land yourself in trouble. Another popular question here is, tell me about yourself. In this particular question, just give them a brief summary of who you are, what you were doing, and mostly focus on healthcare. Like, talk about like the courses that you've done, the certifications that you have, the experience that you have working as a carer, even if you've not worked in, like, let's say like an actual hospital or a nursing home or home care. Let's say you've been taking care of like your grandparents back at home, because that was the experience that I used, that I was actually taking care of my grandparents at home or my grandmom at home, you know, before she passed, and I just explored much more on that particular experience. So when they tell you to tell them about yourself, whatever answer that you give, kind of make it health related, healthcare related, or just some soft skills that you have that would help them say, okay, yeah, you know, then maybe talk about things like, oh, you're passionate, you have good communication, you like to help, all those things, you know yourself. Another question would be, what are your strengths? As well as the fifth one, what are your weaknesses? Okay, and then the sixth one is, how do you give your resident a body wash? So in this particular question, they are trying to understand if you know the concept of dignity and privacy and confidentiality. Very important question, I tell you. I think all of the interviews that I went for, they all asked me this question. So regardless of where you are, in a hospital, nursing home, whatever, in someone's home, the first thing before you actually give a body wash, even you as a human being, most of these questions are kind of like general common sense questions. Even you as a human being, if you want to have a shower in your bathroom, okay, when you know that you're not the only person living in that house, and sometimes even if you're the only person living in that house, you would like to close the door or close the windows at least, so that your neighbors or someone passing doesn't actually look. So that's the same thing you do for these residents. They are not different than us, okay? They are human beings just like us. The first thing would be to close the windows, close the doors if any, and then, you know, tell them the whole process of how you kind of give somebody a shower. Immediately you're done giving them the shower, because these people are elderly people, try to clean them quickly and don't leave them like that for too long. Dress them up as fast as you can. Just explain, but the main thing is actually to preserve their dignity. Okay, another question is, how do you handle a client that has dementia? You know what dementia is, Abby? To reassure the client, you need to be able to have patience, you need to be able to listen to them, give them your time, be compassionate, because most times they don't even know what they are doing. They don't even know that they are reacting the way that they are reacting. and sometimes some of them could be violent, so you need to be careful as well. Whatever incident that you have, you need to kind of document it and report it to your nurse if you feel like you've been abused in any situation. But to be able to handle a client that has dementia, you need to be patient, you need to reassure them, you need to, be compassionate towards them, you need to be able to communicate properly, you need to be able to repeat yourself, because sometimes you're saying, oh, come, let's go and eat, and they are not understanding. You need to just keep on communicating that, come, let's go and eat. Try different ways. Maybe you take a step forward and then they'll follow you instead of saying, come, let's go and eat. Hold your hands. It. Okay, I'm just going to run through the other questions without giving so much answers, because if not, this video is going to be so long. The 8th question is, in a situation you walk into an abuse and your colleague is with the client, what do you do? In that part, when they ask that kind of question, they're trying to understand if you know the different types of abuse. So whatever answer you give, make sure to explain what an abuse is and also talk about the different types of abuse. We have the physical abuse, financial abuse, emotional abuse, sexual abuse, organizational abuse as well. Okay, the next one, so if your clients can't swallow, what do you do? So this is where they say some residents are actually on food level. Okay, so there are some people that eat normal food, there's some people where their food has to be diced, there's some where it has to be like in a puree form, so you kind of have to go through the care plan of the resident to figure out what food level they are on and then act accordingly. So the next question, if your colleagues are gossiping, what will you do? My dear, better walk out of there and not get involved in that kind of conversation. Your colleagues are not your friends. So if you had an argument with a colleague, what would you do? Inform it to your nurse if you cannot settle it within yourselves. But my own approach will always be to try and sort it out within yourselves, because we're all adults at the end of the day. Sort it out within yourself first, and if it's not working, then maybe you can now inform your line manager. They can also ask you general questions like, oh, why do you want to work with us? What are your hobbies? And then they also ask you questions like, are you aware of safeguarding and elder abuse? But all they want to know is if you have a certain knowledge on abuse. To just define abuse, tell them the different types of abuse, like I said, and you're good to go. The next question is, do you have an experience in reading and understanding care plan? Your answer should definitely be yes. Okay, you have an experience in it. So a care plan is like a documentation of a person, kind of like a biography, talking about like where they are born, what they like to do, their hobbies, what they like to eat, the activities that they like to attend. Do they like music? Do they like dancing? Do they like being left alone? They're also going to ask you a question to talk about like the example of when you had a scary situation with a client and how you handled it. So maybe like an abusive person or like a violent resident, and how you kind of handle that situation. The next question is, how do you handle communication with a deaf client that cannot hear? My own answer was, talk as slowly as you can. Okay, take your time and talk as slowly as you can. Make sure that they're looking at your lips, because sometimes they would read your lips quicker and faster. Another one would be non-verbal communication. So sometimes you don't have to talk if they cannot hear you. If you want them to eat and there is a food in front of them, demonstrate doing like this, and they can understand that better than saying to them, oh, please eat, please eat. They can't hear you. So non-verbal communication would work best in this situation. They can also ask you questions like, oh, why are you leaving your previous job? They can also ask you, what does patient care mean to you? Patient care actually means personalized care. Okay, so you're not supposed to look at a job like it's task oriented, especially when it comes to being a healthcare assistant. It's more so supposed to be based off on personal needs of a resident. Okay, so I know in the morning you kind of go to like the home or like the hospital or like the nursing home, and the first thing is to maybe give them breakfast and maybe do the hygiene for them. In a situation where you go to the home of this person and the person's like, I don't feel like eating in the morning, or I don't feel like having a bath, I just want to be in bed, you don't look at it like, oh, you must eat or you must have your bath just because you want to take it down that you've done these things and you've gotten them out of the way. No, it's personalized care. Okay, it's based upon what they want. They're human beings just like you. There are times you don't feel like eating, there are times you don't feel like having a bath, and you just want to be in bed and watch some movies, and they let you do that. So why don't you let them do that as well? Okay, they can also ask you, what experience do you have that kind of makes you qualified for this role? They can also ask you your knowledge on the Health Information and Quality Authority, which is the HIQA. Okay, they can ask you about the standards that are required to contribute to the quality and safety of healthcare. I'll give you the standards. The first one is the person-centered care and support, which I just spoke about. The next one is the effective care and support, safe care and support, better health and well-being, leadership, governance and management, and also workforce. The seventh standard is the use of resources, and then the eighth standard is the use of information. They can also ask you, how do you stay alert during the 9 shifts? They can also ask you skills that make you a good healthcare assistant. They can also ask, what do you understand by the role of a healthcare assistant? They can also ask, like, you know, what questions do you have for them? You know, this is where you kind of ask them benefits that they offer their employees, trainings as well, the typical working schedule, how it's like, if they kind of offer sponsorship for foreigners as well. This is the point where you throw in all of these questions. Okay, if at this point you haven't subscribed, please do subscribe, please do share this video, please do give this video a huge thumbs up, please do leave a comment. It kind of helps this channel to grow. Okay, thank you. They can also ask you, what is dysphagia? So this one I didn't know in my first interview, but the answer that I got when they corrected me actually helped me to ace my other interview. So dysphagia is a medical term for swallowing difficulties. This is where a resident finds it really hard to swallow. They can also ask you why you want to work in a hospital, or why you want to work in a nursing home, or why you just want to do this role. They can also ask you 3 ways your colleague would describe you, your ex-colleagues will actually describe you. They can also ask you, if you want to assist a resident with a shower, which part of the body do you start with? Please, the answer is the face. Okay, except stated otherwise by the residents. They can also ask you, do you give outsiders information about your residents? You already know the answer. It definitely has to be a big no. Okay, GDPR reasons, you can be sued for it. So these are the questions that I have for you to help you prepare for your healthcare assistant interview. Okay, please, if you found this video helpful, please don't forget to give it a very huge thumbs up. Please don't forget to subscribe, and also turn on your notification bell down there beside the subscribe button. Click on the like button as well. Thank you so much, girl, for asking this question. I hope that this actually helps you. I wish you the very best of luck in your interviews, and I'll see you guys in another video. Ciao, ciao.